Hello, hi, this is Grace. I'm following up with my perioperative phases of care for my audience and what to expect. This is the third part, what to expect when they are done with surgery and we receive you in the post-op phase. So the post-op phase, you will be coming to what we call a PACU. It's the post-anesthesia care unit. Once surgery is done, the OR notified the recovery room nurses to expect you. So we know what time you are, we know what procedure you had done. We know what time you'll be showing up, approximately what time you arrive in the recovery room, what equipments we need to recover you from your anesthesia, and what pain medication to give you. So anesthesia, we work very close with the anesthesia team. They give us orders on how to take care of you. The nurses have our standards and protocols. Anesthesia also gives us orders and guide us in taking care of you. So when you arrive in the PACU area, which is also called the recovery room or PACU, you are already sleeping. You are still under, you are kind of sedated. They have taken tubes, and all the tubes out, all the equipments have been taken off you, but except the EKG. So we hook you up to the EKG, blood pressure, your respirations, and we check your temperature as well. All these monitoring system will be in effect until you leave the recovery room. So most of the time, by the time you wake up, you have been with the recovery room nurse for about 30 minutes up. So most patients will wake up right away. They are still drowsy, but they are able to respond to you appropriately. Most patients wake up in pain, either in pain or complain of nausea, but pain is most common. And the nurses have orders. Don't worry if you have a loved one having surgery. The nurses have a series of orders to give you medication in small increments. And based on your complaints of pain, we either rate it based on how you are reacting or based on your behavior or what you tell us. So it doesn't matter if you are not able to tell us you have pain. Once we look at your body language, you are grimacing, you are moving so much, you are having a lot of, we see that you are having difficulty, you are restless, we give you medication just to keep you comfortable. If you have nausea, we also medicate you for nausea as well. Um, Usually, we don't bring family members in right away. We have them wait out until you are all settled. Your pain is under control. Nausea is under control. Yeah, some patients wake up very delirious. Some wake up crying. Others wake up, telling you different stories about their lives. They are not fully aware of themselves. Yes, they are not totally conscious, but we just keep everything. Whatever happens in recovery room, stay in recovery room. We don't tell you what you do, but we expect these things to happen. So usually after about an hour when you are totally conscious and awake, alert, we try and make sure that you are able to drink. You don't have to, but testing and making sure that your swallowing ability is, you are able to swallow, depending on the type of surgery. If you have throat surgery and the doctor says it's okay to give you something to drink, yes, we will give you something to drink to test that your swallowing ability is intact. Now, family members, when we give discharge instructions, we like to have family members available. You can just tell me, unless they insist that the person they are with is not their family member, or they prefer for them not to know what they had done. We have you just, there's a box we check off that you prefer, or we make a note that you insist on not having somebody with you. Other than that, we always have to have a family member with you when we give discharge instructions, because you know what, you might be awake, but you are not alert enough to understand. You forget. Most patients do forget. So depending on the hospital protocol, sometimes your signature is already available, the signature is already there, or we have a family member sign that you are, they are the ones driving you home and you are not driving home by yourself. And please If it's a minor surgery, but you had sedation, don't think you'll be able to drive home by yourself, even if it's as minor as giving you a little sedation. Because I've seen patients come to hospitals, had a simple procedure like colonoscopy, and claim their loved one is in the parking lot waiting for them, and just find out that it's not, they're actually driving home by themselves. That is really dangerous. You're putting yourself at risk, and you're also putting your other people on the road at risk if you drive under anesthesia. So that's all I have for you. Later on, I will do a more detailed video regarding this, but this is just all I have for you. And keep watching my videos. I have more information for you, more stories about my nursing experience. And I tell stories. All right. So have a good day and thank you very much.